Everyone, my name is Niki Armstrong, and I'm a certified genetic counselor here at FAST. This video is to help you navigate ClinicalTrials.gov. ClinicalTrials.gov is essentially a searchable database of human research. If you are interested in participating in research, it is a great tool to understand potential options. ClinicalTrials.gov is based in the United States. Consequently, clinical trials that are occurring outside of the USA may not be listed in ClinicalTrials.gov. So how do you use this website? This is the main search screen, your entry into the database. If you want to start with the broadest search possible, you want to see everything in the database relevant to Angelman syndrome, some of which might be older, I would just enter Angelman syndrome here in the condition disease search bar and then click search. You can see that 43 studies are available, which I actually find overwhelming. Some of them show recruiting, meaning that they are still looking for people to participate, while others show completed. You can click on each one of these and it will take you in to see more information. But I actually like to usually narrow my search, and I do that a couple of different ways. I'm going to go over here on the left on the Focus Your Search section. If I know exactly what I'm looking for, I'm going to go here under Other Terms and type that in. So if I enter Ionis and then click Apply Filters, it's going to pull up all the research studies affiliated with Ionis. And again, I can click on each one of these to get more information. If I know the specific name of the drug, I can enter that under Intervention/Treatment. However, the names and the letter number combinations of drugs can be difficult, so I use this less often. Also, as drugs move along the clinical trial process, the drug may change name, going from a letter number name to an actual drug name. If I don't know exactly what I'm looking for, I'll use some of these other filters here to limit the studies that are showing based on what's important to me. If you are looking at ClinicalTrials.gov because you want to know if there's a clinical trial your loved one can participate in, you will want to use the study status. Not yet recruiting means the study isn't recruiting participants yet, but could start recruiting in the next few months or so. Recruiting means what you would expect. The study sites are enrolling participants. Sponsors are supposed to update their studies whenever the recruitment status changes. Like if it goes from not yet recruiting to recruiting, or from recruiting to active, not recruiting. However, there can be a delay, and sometimes the study will be fully enrolled, but ClinicalTrials.gov might continue to say recruiting after enrollment is full. Eligibility criteria is going to use the inclusion and exclusion criteria listed by the study. These are the rules of who can participate. The sex hasn't really mattered in AS because studies have recruited all sexes, so I would not change that. However, the age has mattered. Because the studies often have a specific age range criteria, I think it's helpful to enter your loved one's current age. If they are close to their next birthday, I would also enter the age that they will return soon. The next section, study phase, is about how far along the drug is in the clinical trial process. We could do a whole separate video about clinical trial phases, but in general, phase 1 trials are first in humans, while phase 4 are typically after a drug has been approved. The further along a drug is in the phases, the more we know about potential benefits and potential risks. The next section, study type, is really important. If you are looking for a clinical trial that is testing a potential treatment, like a medication or potential therapy, you would click the interventional button. Observational studies are really important. Those are all of our natural history studies, registries like the Global Angelman Syndrome Registry and Ladder, but they do not provide any kind of potential treatment or intervention. Their goal is to understand the condition, which we need to do in order to determine if potential therapies are working. You can keep scrolling down, and there are many more options you could use to filter your choices, but this is actually where I usually stop. I click Apply Filters, and then what comes up here is that we have 2 interventional studies that are currently enrolling right now. I can click on the study for more information. Once I get into the study, there is some information here on the right. So we can see that this study started in July of 23. It's expected to finish in March of 2025, and it's enrolling 56 people living with Angelman syndrome. For AS, one of the key inclusion criteria is the genotype or the genetic cause of the Angelman syndrome. There actually isn't a great way to search for this in the Focus Your Search section that we were looking at before. My experience has been that if you put deletion in other terms, it does not pull up all of the deletion Angelman syndrome clinical trials. But this is where you have to dig a little bit, and where talking to your AS clinic or a genetic counselor can be helpful. I'm going to scroll down until I find participation criteria, and then I'm going to click Show More. On the right, I can see the ages that are eligible to participate. On the left, I see the inclusion criteria. These are all the characteristics that a person must meet to be in the trial. So for this study, a person must have a clinical diagnosis of AS, and the person must have a deletion. The deletion must be one of the common AS deletions and include the genes that are typically deleted. The inclusion and the exclusion criteria can get very specific and may include information that you do not know about your child. This is why it's so important to have a healthcare team who knows your child and is familiar with clinical trials. The other section I typically look at is contacts and location, to see the locations of the sites that are participating in the trial. These are usually university hospital or research centers. Where a study is located is very important. With small studies like we are currently seeing in Angelman syndrome, usually you must be located in the same country as a study site in order to participate. Most clinical trials will pay for travel expenses and for some of your time. Still, being in a clinical trial is a big commitment of time and energy, and travel from far away can be hard on you, your family, and your loved ones living with AS. It's important to know that the sites listed can change over time. Especially for big studies, at the beginning there may be only a couple of sites listed, but as more sites get all of their approvals and contracting done, they'll be added to the list. Sometimes contact information for the site will be listed, and sometimes there's only contact information for the sponsor of the study. If there's a study you're really interested in, you should discuss it with your loved one's AS care team. If they don't have a care team, or the care team isn't familiar with the clinical trials, you can reach out directly, either using the sponsor contact information or the information for the site. Sometimes you will hear back from them immediately, and sometimes it will require several reach outs before you hear a response. I hope this video was helpful to you in understanding how to use ClinicalTrials.gov. If you have any questions about clinical trials or would find one-on-one help useful, please reach out to me directly at Niki@curaangelman.org. Thank you.